infecting over 155 million people in just over a year, shutting down global economies, restricting travel nationally and internationally, COVID-19 has officially pressed the pause button on humanity. With the global death toll standing at 3.2 million, COVID-19 is a force we should all be afraid of. Or should we? Have we been tricked into panicking? Are the governments and the media causing mass hysteria to elicit humanitarian control upon the people to an extent which we have never seen before? Well, let's take a deep dive into the numbers so we can make our own conclusions. First of all, we need to establish a way to measure your chances of dying from COVID-19. That way we can decide if the way in which the world has responded is in fact justified. Luckily, there are two ways that already exist. The first one is the crude mortality rate. This is the chance of you dying from a disease relative to its exposure to the population. This is an important measure because it not only takes into account the likelihood of you dying from COVID-19, but it also factors in the probability of you even catching it. The other method is the one which gets the spotlight. This is the case fatality rate. This is the chance of dying from a disease once you have caught it. This particular measure leaves out the probability of contracting a disease. The next step we need to take is to calculate both the CMR and the CFR. With 155 million people infected and 3.2 million having unfortunately passed away at this time, we can calculate the case fatality rate, or the CFR, to be around 2%. The crude mortality rate, or the CMR, is significantly lower if we take into account the global population size, which as at 2020, according to Worldometer, is 7.795 billion. This puts the CMR at 0.04%. So right now, your chances are looking pretty darn good, right? You've got about a 98% chance of surviving if you caught COVID-19 according to the CFR, and a 99.96% chance of surviving when taking into account the probability of you ever actually catching COVID-19. However, we want to take a clearer look at these figures and start to remove some of the bias, as there are some clear problems with these two measures. Let's start with the crude mortality rate. The probability of you catching and dying from COVID-19 at the moment is so low, but perhaps the main reason for this could be the economic standstill we currently find ourselves in. When the world opens back up, this probability of dying is likely to rise. Another issue with this measure is that some countries have more advanced social and technological infrastructures, and in these countries the crude mortality rate would probably be higher as a result of inventions like public transport, gyms, and mass social gatherings, due to the closer proximity these activities result in. Let's take a look at the case fatality rate, as this number is perhaps a little more accurate regardless of the current state of the world, as the measures we are currently restricted by do not change the performance of the virus when it comes to mortality. So you've got a 2% chance of dying on average. Would you take those chances? Do they seem high or low? I'm willing to bet that you have no idea whether those chances are high or not. So let me enlighten you. Here are some random causes of death which you could end up conceiving to. These figures come from the US, so may vary depending on your location. Common cold, 0.1%. Dying in a car accident, 1%. Dying from a fall, 1%. Suicide, 1.1%. Opioid overdose, 1.1%. Coronavirus, 2%. Cancer, 14%. Heart disease, 17%. But the one thing we are all forgetting here is the coronavirus numbers are not anywhere near as mature as the other measures on this list. It's only been around for just over a year, so how accurate is the 2% reported figure? Let's discuss the problems with the case fatality rate we are seeing. First of all, the number of deaths reported is something we can take to be true. Now technically there could be cases of countries underreporting the total deaths from COVID-19, and yes, this could skew the data. But how likely is it that a country can systemically lie about a global pandemic? This is only one part of the equation. The second part is the total number of cases, and this is where the real problem kicks in. The total number of cases is measured by counting the number of confirmed positive test results that a country has conducted. This leaves out two major groups of contributing cases. The first group is people who do not get tested for whatever reason. Perhaps they confuse the symptoms with that of a cold. And the second group is asymptomatic cases. This is people with no symptoms. These two groups could be extremely large given the similarities that the COVID-19 symptoms share with other respiratory diseases. So with these two large problems now presented, it is likely that the number of people that have contracted coronavirus globally is potentially much higher than the reported 155 million. And that would also mean that the CFR could technically be much lower than 2%. Or in other words, your chances of dying from COVID-19 could be much lower than 2%. Maybe some of you are watching this and thinking, 2%, that's too high for me. I think the measures we have in place are not strict enough. Or now we will dive even deeper and decipher a more accurate chance of dying from COVID-19. To establish the most accurate picture of your chances of dying, we need to assess how closely related you are to the people that have passed away from COVID-19 and if you share any of their characteristics. The two main comparisons we will be making are age and health. Let's start with age. Again, we are using US statistics here. As of April the 28th, 2021, approximately 557,000 deaths from COVID-19 have been recorded in the US and total confirmed cases at 32 million. On screen is a chart showing the proportion of deaths sorted by age. This graph shows us that the number of people dying from COVID-19 is heavily skewed towards those over the age of 65, and that perhaps the CFR of 2% is a blanket statement, and it would be more accurate to say that your chances of dying from COVID-19 may be significantly higher if you are older and significantly lower if you are younger. So what are your chances of dying from COVID-19 by age? To accurately measure this, we would need to know a breakdown of the positive cases by age, and then calculate the number of deaths as a proportion of each of these respective groups. Unfortunately, this data is hard to come by, so we will have to make the following assumptions. The first assumption is that the 32 million positive cases represent an accurate distribution of the US population by age. And the second assumption is that the US population hasn't changed materially in the last 2 years. Taking these assumptions and applying them to the 32 million positive case results, you get the following approximations. If you are under 50 years old, your chance of dying from COVID-19 if you caught it is 0.12%. If you are between 50 and 65, your chances of dying are 1.41%. And if you're over 65 years old, your chances of dying are 8.54%. Okay, so what if you had underlying health conditions? This is actually a very difficult characteristic to measure, and often data is manipulated to deliver a particular narrative. The first problem is, how do you determine how someone dies from COVID-19? The death statistics count a death from COVID-19 as anyone who has passed which had COVID-19 written on their death certificate. So already perhaps we are amplifying the severity of this disease by attributing deaths which may not have been caused by it at all. This table shows a breakdown of the 557,000 US deaths from COVID-19 and the conditions that were present on the death certificates in addition. The problem with this data is that the conditions on this list are not mutually exclusive. In other words, you could have multiple conditions on this list, and potentially this would mean your chances of passing from COVID-19 are higher. The most critical point I found when researching this data is that the CDC confirmed that just 5% of the total deaths had only COVID-19 written on the death certificate. This means that 95% of COVID-19 deaths had other causes written on the death certificates. So how likely are you to die from COVID-19 if you have underlying health conditions? It's unclear at the moment, as the data is vastly complicated, but you can see a general trend in this table that as we look at the older people, the number of them dying from the conditions listed goes up dramatically. This points us to two potential conclusions. Number one, age is a more important factor in the fatality of COVID-19. Or, number two, older people are more likely to have underlying health conditions that would subsequently result in COVID-19 being fatal. To define whether COVID-19 is in fact deadly because of your underlying health conditions, we would need to understand the underlying health conditions of the entire 32 million infected people to calculate a percentage of how many died with any given health condition. Until this data becomes available, the conclusion is unclear at the moment. Now, if you've made it through all this data, then I applaud you because there's been a lot. But here are the key points to take away. 80.2% of all COVID-19 deaths are from people over the age of 65. Only 5% of COVID-19 victims died as a direct result of COVID-19. Here are the chances of dying from COVID-19 by age. Your chances of dying from COVID-19 are very, very slim. Do not believe everything you are told by the media. Do your own research. Live your own life. Do not live in fear. Now, go and get your vaccine. Or should you?